muscle, sternocleidomastoid muscle. This is the posterior border of sternocleidomastoid muscle. Skin is reflected up to the anterior border of trapezius, middle third of the clavicle, forming the posterior triangle. Posterior triangle is divided into occipital triangle above and subclavian triangle below by one muscle, inferior belly of omohyoid tendon আছে, so inferior belly of omohyoid muscle, ঠিক আছে, এটা continuous with the superior belly of omohyoid muscle. So this subclavian triangle, the structures we have to identify, first one is subclavian vein behind the clavicle, দেখা যাচ্ছে দেখ, behind the clavicle আবার দেখাবো, subclavian vein. Deep, in a deeper aspect, we have to identify the third part of the subclavian artery, দেখা যাচ্ছে above, আচ্ছা দেখাবো ওদিক থেকে আসবি, third part of the subclavian artery on its medial aspect, one vertically oriented muscle fibers can be seen as a scalenus anterior muscle. Upon the scalenus anterior muscle, one vertically down nerve can be seen, phrenic nerve. All these structures will be covered by sternocleidomastoid posterior border of the sternocleidomastoid muscle. Mesh. And the other structures which we have to identify are three trunks of brachial plexus, যার মধ্যে upper trunk is this, middle trunk is this, and lower trunk will be behind the subclavian artery. তিনটে trunk দেখা যাচ্ছে এবার দেখ, the trunk which I am holding is the lower trunk, this is the middle trunk, this is the upper trunk of brachial plexus. Three trunks of brachial plexus, subclavian artery, subclavian vein, scalenus anterior muscle, phrenic nerve. This much you have to identify in the subclavian triangle.
Scalenus anterior muscle.
Scalenus anterior muscle. Scalenus anterior muscle, phrenic nerve. Upper trunk, middle trunk, lower trunk, subclavian artery, middle trunk, subclavian artery, third part, holo, inferior belly of omohyoid muscle, mesh. Occipital triangle, in occipital triangle we have to first identify one nerve which is the highest content, going backwards, going backwards from the posterior border of sternocleidomastoid to the anterior border of trapezius. এটা কি? Spinal accessory nerve. Just parallel and in the lower part of the spinal accessory nerve,
We will have C3, C4.
two nerves, C3 and C4. Upon all these three structures, upon one muscle, levator scapulae muscle. Holo? Besh. The lower muscle, this one, is the scalenus medius muscle forming floor of both occipital and the subclavian triangle. So scalenus, over the scalenus medius muscle in the subclavian triangle, we have these trunks of brachial plexus. The levator scapulae, scalenus medius, spinal accessory, C3, C4. Now coming to the vein. This is the superficial vein, which is the external jugular vein. External jugular vein will be formed at the lower part of parotid gland. Lower part of the parotid, this facial artery. This is the parotid gland. This is the lower pole or apex of the parotid gland. So this vein will come down, cross the sternocleidomastoid muscle superficially, then it will drain into subclavian vein. Okay? Besh. Now we have to identify the superficial nerves, cutaneous branches of the cervical plexus. Conta spinal accessory, this one is spinal accessory. So from the middle of the posterior border, one nerve will hook the spinal accessory nerve, will go upward towards the occipital region, that is the lesser occipital nerve. It will follow the posterior border of sternocleidomastoid muscle. One nerve will accompany the external jugular vein, will supply the
Great auricular.
হ্যাঁ দাঁড়া দেখি এটা এই যে will supply the angle of the mandible skin, which is the great auricular nerve. One nerve will go horizontally up to the anterior border. This nerve will divide into superior inferior division. Inferior কেটে গেছে, that is the transverse cervical nerve. The last branch, superficial branch, will be supplying the clavicle. That middle branch, medial branch, lateral branch and intermediate branch. We have three branches. Three branches of the supraclavicular nerve. So this is supraclavicular nerve. This is transverse cervical nerve. This is great auricular nerve. And this is occipital nerve, lesser occipital. This one. Lesser occipital
আমি
nerve.
হুকটা কোথায় করেছে?
বল
হুকটা
এইখানে হুক করবে, যেখান থেকে বেরোচ্ছে। এটা তো নিচে বেরোচ্ছে, এই যে এটা নিচে বেরোচ্ছে তো,
হ্যাঁ, হ্যাঁ।
এইটা তো স্পাইনাল অ্যাক্সেসরি এন্ড C3।
হ্যাঁ।
এটা স্পাইনাল অ্যাক্সেসরি, এটা C3। এই এখান থেকে নিচ থেকে বেরোচ্ছে, কই হুক
আচ্ছা
করে
আচ্ছা
উপরে উঠবে,
ছিঁড়ে গেছে ওটা।
ছিঁড়ে গেছে। হ্যাঁ, এইখান থেকে এটা ট্রান্সভার্সলি যাবে, আর এখান থেকে এই ব্রাঞ্চটা অর্ধেকটা ছিঁড়ে গেছে। হ্যাঁ, অ্যাঙ্গেল অফ দ্য ম্যান্ডিবলে যাবে। এটা গ্রেট অরিকুলার, এটা ট্রান্সভার্স সার্ভাইকাল, এইটা লেসার অক্সিপিটাল, এইটা সুপ্রাক্লাভিকুলার।
Party